Over the past several decades, Kenya has become an economic and innovation hub in East Africa, growing from all sectors including healthcare. Kenya's healthcare sector is one of the most dynamic in Eastern Africa. Of importance to note is that rising income and population over the last decade have fueled rapid growth in the health sector, particularly among for-profit providers. On the other hand, the Kenyan government has been grappling with rising healthcare costs due to increased demand for healthcare services, devolution of healthcare services, skilled health personnel shortages in the face of a huge population and ongoing budget constraints.
Poor health consumers are actually paying more than those who are insured or had higher incomes. Why? Because they had poor quality of delivery. They'd end up going repeatedly to get the same problem treated. We discovered a phenomenon called the poverty penalty. Because the problem wouldn't get solved, they'd pay again and again, they'd lose work and end up actually spending more.
The desire to improve operation of public health services and facilities and to expand access to higher quality services are among the key factors driving governments worldwide to use the public-private partnership model, whose results include more potential partners for governments as private healthcare sector matures and a significant percentage of the poor seeking affordable quality healthcare at for-profit health services.
The private sector, development partners, public sector, counties, faith-based organizations, we should form a strong partnership, and it's only then we will achieve universal health coverage in Kenya. The public sector and the government will and cannot do it alone.
Over the last 10 years, interest and experience in leveraging the private sector to achieve national health goals has grown. In response, DFID designed the Private Sector Innovation Program for Health, PSP4H, to carry out action research into how a market systems approach might benefit pro-poor health interventions in Kenya.
The Private Sector Innovation Program for Health, PSP4H, was conceptualized by DFID in 2013 as a 2-year action research project to get proof of concept on if the M4P, or making markets work for the poor approach, would work in the health sector.
The key principles of M4P are that it must be pro-poor, facilitative, systemic and scalable. So the objective is to foster sustainable healthcare business models that result in a win-win scenario, whereby that clinic will be making profits and we're also increasing access and affordable healthcare for the poor.
PSP4H supported the private sector to invest in providing healthcare products and services to the poor by conducting market research, assisting them put together strategies, business plans, and helping them market products and increase bargaining power in the market by doing it collectively. The program understood how the working poor in Kenya access healthcare products and services from the for-profit private sector and at the same time foster private sector investment in better serving the healthcare needs of the working poor.
Everything that was available for them was not quality. Our research informed us that if we target the private sector, the poor can actually access quality, affordable healthcare.
As a first initiative, PSP4H had to map out 273 donor health programs in Kenya in March of 2014 and identified 7 underserved areas within the Kenyan health market where market systems development programming would work best. They were
non-communicable diseases, supply chain, diagnostics, low-cost delivery models, healthcare finance, e-health and m-health, and maternal health.
Through PSP4H, Cardno employed the principles of the Making Markets Work for the Poor, which seeks to sustainably reduce poverty by identifying and addressing where markets work inefficiently for the poor.
Some of the key innovations we came up with were networks. We found that it was easier to bring these people together, running their own business as theirs and enlightening them on what they're supposed to do. Taught them on business skills training, which was lacking, and we directed traffic towards their business. And by doing that, we eliminated a lot of quacks, and you found that the working poor, the low-income earners, at the end of the day, got information on where to get the right drugs.
PSP4H partnered with the Kenya Pharmaceutical Association (KPA) to develop the PharmNet network of affordable, quality-assured pharmacies with 323 outlets in 7 Kenyan counties as of late 2015. PharmNet outlets are owned and operated by independent KPA members.
Our medications and everything and all the services, they are of good quality compared to the previous times when we were not under PharmNet. So far it has boosted our sales. That is one thing. Of course, when you're in business, that is what you look at.
PSP4H has been an innovation center for private health sector investors with innovative ideas. The objective is to foster sustainable healthcare business models that are win-to-win and profitable for business while delivering better value to the working poor. Cardno then widely disseminates lessons learned through 3-pronged communication strategy: publications and website, media and dissemination events, and social media channels such as Twitter and LinkedIn to extend outreach.
Yoguka kurutuo kirio muthi bandage ndakiheo dawa sitea ni thibitari njega iratuthondeka na nitukenete tondu turari gutuika itumumu na turi andu ega marehota nguga ni thengio kurio.
PSP4H has acted as a healthcare consultancy firm to private healthcare partners, supporting partners in investing in activities that will enable them to better serve the poor.
We've known PSP4H for the last 3 to 4 years. They came in, helped us market. We had few billboards put across the city. We had many people calling to make inquiries about our services. Right now as we speak, we've gone to an average of around 55 patients.
PSP4H also assisted partners establish networks of private facilities where they are able to enjoy the benefits of co-learning, jointly accessing training and other opportunities, and having increased bargaining power in the market.
A business model was found to be important for this project. Most of them are clinical officers, others are nurses who qualified from their school of training, and they went into business without any understanding on business management. So you find a clinic has operated for 30 years. It's not closed, but it's not grown. That means there's a problem. And the problem could not be business, because then if there was no business, they would be closed. But they can't grow because they don't know how to grow the business.
We have managed to digitalize our issue. Initially we used to see 5 to 10 patients. That's before the LabNet issue. But now currently our numbers ranges from 15 to 20 per day visit. We have actually managed to win most of the people confidence.
The business models were cash flow management, inventory management, and customer care. And you realize customer care is a big issue in health service delivery.
Despite saving more than 52,000 lives of women and children between 2003 and 2014, Kenya is yet to achieve the targets set by the UN's Sustainable Development Goals (SDGs) that require countries to cut maternal mortality rates by 3/4 by 2032. Speaking at the launch of a report on Kenya's progress in reducing maternal and child deaths in May of 2017, the First Lady Margaret Kenyatta said that despite the milestones achieved across the world, there still remains too much disparity and inequity in access to health among women.
Eunice gave birth here, and she gave birth in twins, both female, alive, and she gave birth SVD, whereby there is no any operation which was done.
PSP4H, in capacity building of the members, we have taken much of the load which was on the public hospitals. The rate of maternal and neonatal death has reduced significantly, and this was to counter the efforts of traditional birth attendants, which were really causing a mess to these mothers.
The program had 6 ongoing pilots with a total budget that is less than a typical DFID Challenge Fund grant, showing that the M4P approach to healthcare can offer development funders outstanding value for money. PSP4H also partnered with other stakeholders to establish asthma model clinics in Nairobi.
We had the face-to-face trainings, and then we also had the e-learning that was whereby the learners are provided with credentials to log into the platform and go and study about asthma on their own.
The mandate of the Asthma Care Improvement Project, ACIP, is to develop and implement a sustainable asthma initiative targeting low-income populations in Kenya.
TOTs would support the e-learners, maybe through the practical sessions, the proper use of an inhaler, an nebulizer, and even coming up with innovations for nebulizers in case a facility does not have.
The project aims to build on existing asthma care partnerships in the public and private health sector, subsequently leading to the reduction of the burden of asthma care and management in Kenya.
Malipo kawaida huwa ni mazuri na wanatushughulikia vizuri, na hata madawa ambao wanatupatia pia yanasaidia sana. Yametusaidia sana.
PSP4H as a development program is a model for the development world in that it showed value for money, it showed adaptive management, it showed private sector investment, it showed leverage of the donor's investment, it showed payment by results, and overall it came up with some sustainable business models that can be used in the future to bring for-profit healthcare to the mass market in the developing world.